Thank you for coming today. My name is Josh Wynn. I'm the program coordinator for Buckeye Wellness. I want to thank you all for attending today's Lunch and Learn. Just a couple upcoming announcements from our office. We have the ROTC Wellness Bootcamp next Wednesday. Today is the last day to register a team or for yourself. So if you are interested, the link is right there. go.osu.edu/wellnessbootcamp. May 13th through the 17th, we are hosting our first annual Wellness Week here at Ohio State. So every day from the Med Center and the university side, we're going to hold an event. So check out yp4h.osu.edu/events to see what's going on during that week. And lastly, from our office, we're hosting the Amazing Race to Wellness over at Lincoln Tower Fields. It's based on the TV show Amazing Race. You'll be traveling around the 9 dimensions of wellness with the team. So if you're interested in that and registering, you can visit go.osu.edu/amazingrace. If you have not scheduled your biometric screening, Dixie can take appointments today. She has a couple left. If you are looking to schedule that as well, you can go to linktohealth.osu.edu. For today's Lunch and Learn is titled Evidence-Based Strategies to Manage Stress and Anxiety. Our speaker is Dr. Sophie Lazarus. She is a clinical faculty in the Department of Psychiatry and Behavioral Health here at the Wexner Medical Center. Her work focuses on treatment and research in individuals with mood, anxiety, and personality disorders, and delivers and supervises trainees in cognitive, behavioral, and mindfulness intervention. So we'll have about 10 to 15 minutes after our presentation for any questions that you have. If you're tuning in for the webcast, you can email me, winn.50@osu.edu, and I will ask that for you. So if you can, please welcome Dr. Lazarus.
This will go on, right?
Yeah, I'll say.
Okay. Can people hear me? Oh, that's amazing. Okay. Well, thank you so much for that introduction. And I'm really happy to be here today to talk to you about some evidence-based strategies to better manage stress and anxiety. Like Josh said, I'm a clinical psychologist here in the Department of Psychiatry and Behavioral Health. And I actually did my graduate work here at OSU with Dr. Jen Chevins. And so that's where I really got introduced to some of these techniques that we're going to be talking about today. And we're really going to be talking about cognitive behavioral therapy and mindfulness. And so after completing my graduate training, I did leave and do some additional work, research and treatment in folks who struggle with anxiety, depression, and personality disorders. And besides the fact, so I'm not from Ohio, but part of what ended up bringing me back to Ohio was that I was really interested in providing training for clinical psychology trainees in these evidence-based treatments and also providing treatment myself. But also I had the opportunity to start a mindfulness-based cognitive therapy program here. And I'll talk more about that later, but it really combines the two things that I love and believe in strongly, cognitive behavioral therapy and mindfulness for folks who suffer from chronic depression and anxiety. So in terms of what I'm going to be talking about today, I was really excited to be talking about this topic. And that's partially because I have really seen both personally in practicing these strategies and then also, of course, in using them in my work with patients that, you know, in really learning and consistently applying these strategies, you know, we can develop the skills to face challenges with a bit more balance and a bit more ease, ultimately. And so I want to just talk a minute about this first slide and why I have evidence-based here. So it's really important when we're looking at a particular problem to look to the literature and get a sense for what is the best treatment. And when I say what's the best treatment, I mean what has the most evidence for these problems. So that's exactly what I'm talking about here for depression and anxiety. So the same way that if you went to the doctor, for example, and you had high blood pressure or diabetes, there would be a first-line treatment for that problem. These are really the first-line treatments for depression and anxiety here. Okay. in talking about what are stress and anxiety, when Josh gave me the opportunity to kind of pick a topic for what I wanted to talk about, this really stood out to me. So I've been back in Ohio now 2 years, and across my personal life, professionally, around the med center, working with folks in different contexts, we are kind of stressed and anxious. It is really evident, right? And so what I'm seeing, and I'm sure perhaps you guys can agree with me, is that there are just increasing responsibilities when it comes to work. We're working longer hours. We've got lots of responsibilities when it comes to family, stressors around finances, stressors around our health, stressors when it comes to the kind of political and social climate. And so it's really kind of in this context that we need to be thinking proactively about how to better manage stress. The other thing that I just wanted to say briefly when it comes to stress and anxiety is that I think it's important to think about the increasing role of technology and the role that that may play in our stress and anxiety. So, of course, the intention of technology is that it makes things easier for us, right? We can just pop open our Google Calendar, put something in there, and it's easier than taking out our planner and writing it down. At the same time, this also means that we are always accessible, right? If someone wants to reach us, they shoot us a text, and bam, there it is right in front of us. Or they shoot us an email, they give us a call. And part of what this means is that we just have less space to engage in the types of behaviors that may increase our resilience to stress, right? So things like uninterrupted time with family and friends, or self-care, right? Maybe like taking a bath, reading a book, exercise, preparing healthy meals, right? So this means that we have less uninterrupted time for that. And also, I don't know about you, but I often find myself like in the grocery store, I'm in line and I'm like going through my phone, right? And it's because I'm like impatient, I'm stressed, I'm uncomfortable, right? So we often turn to our technology when we're feeling perhaps stressed or uncomfortable. And in that way, we avoid the stress and discomfort, but we may miss perhaps important signs or signals about how we're doing by going and distracting, maybe cruising through Instagram or shopping online or whatever we're doing on our phones. Does that make sense? Yeah. Okay. So hopefully everyone has had a chance to get some of their lunch, because I'm definitely going to be asking for participation. So, this is called Lunch and Learn, and really I've found that the more that we engage with the content and the information, the more that we end up learning, right? So who here has ever felt stressed? Okay, so right, if you didn't raise your hand, you're lying. We all feel stressed, right? And who would mind telling me what types of situations stress you out? Yeah. Right before losing my doctor. Say that again? Right before I lose my doctor. Medical visits, yeah, going to medical visits. What else stresses people out?
Any situation where you maybe don't feel control of, or like you don't know the answer?
Yeah, so if we don't have control or know the answer, right? We don't like that, exactly. What else?
Competing priorities. We have everything due at the same time.
Yes, so we have competing priorities. It seems like everything is number one, but everything can't be number one, right? And then how do you know that you're stressed? Like, what shows up that tells you that you are stressed? Yeah, antsy, on edge. What else? Yeah, so our breathing, our kind of respiration is increased. What else tells you you're stressed? Yeah.
My stomach hurts.
Oh. Yeah, so we get indigestion, our stomach hurts. What else?
Sleeping patterns change.
Absolutely. So stress shows up in a lot of different ways for us. So in terms of really a definition of stress, stress really is this broad term that encompasses our response to any demand or stressor, right? So this can mean our thoughts, emotions, and sensations that come up in response to that stressor, but it also encompasses this biological response, right? So the release of hormones and neurochemicals that are released to help us meet the demands of that situation, right? So when we think about stress, in an ideal world, stress is kind of time limited and stressor specific, right? So we've got an upcoming talk to do, or we've got a event or a vacation that we're going on, right? And so this would be kind of an example of time limited stress, but we know that stress can become chronic, especially when we have situations like we're just mentioned, right? We have all of these kind of competing demands and it doesn't really seem to go away. So overall, like you guys have talked about, we seem to understand that stress has an impact on us and want to change it. That's why you're here, right? So we may recognize stress as kind of worries that we can't get rid of, or we may recognize that our stomach hurts. The problem tends to be that we have competing priorities when it comes to proactively managing this stress, right? So although we know that it is a problem, it ends up being difficult. We have lots of barriers, probably the number one barrier of which being time, right, in order to manage our stress more wisely. So in terms of why this is so important, or why this topic is so important, I thought this first statistic was really compelling. So 75% of all physician office visits are for stress-related ailments. So whether stress is the direct cause or whether it's kind of a downstream consequence of stress, stress is having a major impact on our overall well-being. Similarly, according to the APA, chronic stress is implicated in the 6 leading causes of death. So heart disease, cancer, lung ailments, accidents, cirrhosis of the liver, and suicide are all associated with chronic stress. So part of what this implies is that we all have limited resources, right? But allocating our limited resources to really addressing our stress can have really broad consequences for our health. So if we're going to work on managing stress better, we want to know a little bit more about how stress ends up emerging or how stress comes about. So let's say we have this situation, and I'm guessing a lot of us have maybe been through this situation where we have a change in our role at work, right? So our role at work changes. And the first important thing in determining stress here is whether or not we think that this is a threat, right? So this is really our appraisal or our interpretation of the situation, right? So if we think, oh, no, this is great, not a big deal. No stress, no problem, right? However, if we think, oh man, this is going to be bad, this really could have negative consequences for me, then we're going to have stress. And there are additional appraisals that really determine whether or not how much stress we have and what kind of stress we have. So the next question that's really important in determining stress is our evaluation of whether or not we can cope with this situation, right? So if we think, I've been through previous situations like this, like there was a role change a couple years ago, and even though it was really challenging at first, I ended up coming through okay. Actually, it was for the better. Then we think, yeah, I can cope, and this may be positive stress. So stress is stress, but this might be a situation where we have positive stress. Alternatively, if we think, no, this is totally going to sink me, I'm not going to be able to juggle this and my other responsibilities, I really don't know enough to take on this role, then we have negative stress, right? So there are a couple things about this process that I think are important to point out that gives us some hope, right? So the first thing is that the boxes that are in red here, these are our own interpretations or appraisals of the situation, which in some ways suggests that we are in the driver's seat here. We have some ability to affect how much stress and what type of stress we experience, right? So we can't get rid of stress altogether, but certainly we can affect stress. And the other thing is that stress is not all bad. Right? There can be stress related to an upcoming trip that we're really excited about, or stress about a new role that we really care about, or a wedding, right? So stress does not necessarily bad. Does that make sense? Okay. So now anxiety. And here's where I'm going to ask us to participate again. So raise your hand if you have felt anxiety. I think also everyone is raising their hands here, right? So anxiety is a really normal human experience. Now, how does anxiety show up? How do you know that you are anxious? Love that. I mean, I don't love it because that's right. That sounds very difficult, but great answer, right? So we have these kind of compulsive thoughts running through different possibilities. Yes. What else? How does the anxiety show up for you? So self-conscious, maybe hypervigilant, kind of on edge. Yeah. What else? Yeah, so it might really escalate so that it kind of culminates in a panic attack. Great. And so yes, anxiety is different than stress. Certainly there's overlap. So if you think back to the slide I just showed on stress, right? If we think I'm having this role change, but I can cope with it, we're probably not going to have a ton of anxiety with positive stress. It's really with the negative stress where anxiety comes into play, right? So anxiety is the anticipation. And anticipation is really a key word here, of some feared situation or outcome, right? And this comes along with things like feeling really on edge, lots of worry, tension, irritability. And so with anxiety, we are really, we often end up kind of running through all the possibilities, and we end up in a cycle of quite a lot of worry, thoughts about what might go wrong, right? So has anyone ever had this situation happen to them? Hopefully it's not just me, where you send out a text message to someone and they don't respond, and you, okay, good. So you send out a text to someone, they don't respond, and then you're like, oh man, I hope they're okay. I hope nothing happened on the way here, you know, and we start kind of running through the possibilities, or gosh, I hope I didn't do something wrong. It's been a long time since I text them. And then what happens is, at least for me, we end up running through these possibilities. But as we're doing that, we are suffering this predicted future possible fate, right? We have all the anxious thoughts associated with it. Our body is really aroused and on alert. And, you know, we get to this like we're imagining ourselves at their funeral. How painful, right? Only to get a text back and be like, sorry, in the shower. So this is how anxiety can become really problematic, right? We suffer these potential outcomes that may not come to fruition in the end. So as negative of a picture as I'm painting of anxiety right now, can anybody talk about why anxiety might be positive or helpful at all? Why might we not want to get rid of anxiety altogether? Yeah, so it motivates you, right? So if I didn't feel a little anxious about this talk, then I wouldn't have prepared, right? And why am I anxious about this talk? Because I care about this content and I care about helping people. So in some ways, anxiety, when it is at a moderate level, is really helpful for moving us forward. And it can also be an indicator, actually, I think, that we're moving in the right direction, right? When we think about those things in our lives that we really care about, we are going up for a promotion, we are making a commitment to a partner, we are learning something new. Anxiety is unavoidable. Anxiety is going to be there, right? But we want to keep it in this middle range, right? Because when it gets really extreme, we freeze, right? We're paralyzed. We don't move forward. Does that make sense? Okay. So some facts about anxiety that perhaps suggest why it's really important, again, that we learn to manage anxiety. So 31% of adults will experience an anxiety disorder at some point in their lifetime. And unfortunately, anxiety disorders, when you look at kind of past year prevalence, about 10% more prevalent in women than in men. We also know that anxiety disorders are serious, right? So when we think of psychological disorders, we don't think of anxiety disorders as like the top, most serious, but certainly among those with anxiety disorders, you see elevated rates of substance use disorders, which I'll talk about in a little bit, and you also see elevated rates of suicidal ideation and suicide attempts. So we really want to understand how we can manage this better. So, I've just kind of talked about, well, anxiety is not all bad and stress is not all bad, right? So when do anxiety and stress become a problem? So this was my word cloud that I worked very hard on doing. I can tell you the website if you want to know how to make one. But, what happens is that when we're in this aroused state, the body is releasing adrenaline. The adrenaline leads to elevated heart rate, respiration, tensing our muscles, changing our blood flow, right? And when we acutely need to get something done, or when we're in an emergency, that's great. Go on, right? At the same time, when our anxiety is misfiring, right? When we're imagining a situation that is not before us, or when this is happening chronically, this response really becomes problematic. So it really becomes negative when we're facing more continuous challenges without an opportunity to rest, right? For this response to go away, for us to return to a relaxed state. That's when we really get a lot of wear and tear on the body, both mentally and physically. And so this ends up showing up in some of these ways that I have here. So, it shows up physically in some of the things that we already mentioned, right? But in terms of how it shows up physically, we might have aches and pains, we might have indigestion, we might have, anybody kind of notice some pain in the jaw, right? So it starts to show up in our body in these ways. It also shows up psychologically or emotionally, right? We may feel really angry or irritable. We may feel more kind of quick to emotion or tearful. So certainly it starts to show in us feeling really overwhelmed. And then finally, this ends up starting to show up in our behavior, right? Anybody ever procrastinate because they were anxious, like put something off? Yeah. So this shows up in our behavior in procrastination, but we also may try and avoid these difficult emotions in other ways that really cause problems for us, right? So maybe we have another glass of wine, right? Or maybe we want to distract, so we go online and we shop, or other kind of compulsive behaviors. So, when thinking about these behaviors, this is really kind of what I want to focus in on, is that, we attempt to manage our stress and anxiety in ways that unfortunately add to our problems, right? We go online, we order a couple things, and maybe we feel a sense of relief for the moment, but then our credit card bill shows up, right? So with some of these behaviors, actually serves to maintain the stress instead of relieve the stress. Does that resonate at all with folks? Okay. So this is the exhaustion funnel. And what this represents is that overall we tend to be kind of caught in this vicious cycle where we are managing our stress in unhealthy ways, and there are real barriers to managing it more healthfully, right? And so what often happens is that we miss some of these perhaps early warning signs that may signal, we should probably stop and take care of ourselves. So we miss these early warning signs and we go harder, right? When we feel stressed or anxious, it's like, well, I just need to stay a little later. I just need to finish that. Actually, I'm not going to go out with my friends after work. I'm going to keep working, right? And so what happens then is we miss out on opportunities for relaxation, to feel a sense of replenishment, and our mood drops, and we're more vulnerable to anxiety. And as you're seeing here, we really kind of get into this funnel where we end up hitting bottom. We end up in a state of real exhaustion and sickness. And so ultimately what we would hope for is that to notice earlier on some of these warning signs and respond in ways that are helpful so we don't end up in an emergency. So I want to spend most of our time talking about, okay, great, that sounds good. So how do we do this, right? So, there are lots of really great strategies to manage stress, right? There's relaxation strategies, exercise, healthy eating, using assertiveness skills to ask for what we need, increasing our problem-solving skills. But I'm not going to talk about those today. I really just want to talk about two main skills that I think that if we can start to get those skills on board and apply them more consistently, they can really have big effects for us. So I'm going to hone in. So before we get started, I want everyone to close their eyes if that's comfortable for you. If it's not comfortable for you, you're welcome to just cast your gaze down on the floor. And I'm going to ask you to imagine a scenario, okay? So imagine that you're walking down the street, and on the other side of the street, you see someone that you know. So you smile and you wave, and that person doesn't seem to notice they just walk by. How do you feel? What is going through your mind, and what do you feel like doing? So you can bring your attention back to the room, and I would love to hear when that happens, what came to mind for people. How did you feel? Embarrassed, okay. Yeah, so you thought maybe they don't know who I am, felt embarrassed. What else? What else went through people's minds? Yeah.
Well, I get in a zone a lot of times when I'm walking or whatever, and I think I would have just said, oh, well, they're just not.
Yeah.
They're not paying attention to what's around them.
Yeah, and how would you feel if that's what you thought?
But I'm okay with that.
Yeah. Yeah, not a big deal. Wonderful. What about you? Yeah. Why are you ignoring me? They're ignoring me. And then how would you feel if you thought they were ignoring you? Yeah, annoyed, frustrated. Anything else that stands out to people if that happened to you? Yeah. Yeah. Yeah, so we would think other people saw us and that they're thinking negatively about us, feel dumb and maybe embarrassed, right? Okay, great. So I love that. So because I couldn't be writing down your answers as I did this activity, these are kind of some of your typical answers, and this is what some people said, right? So maybe they didn't see me, I'm often zoned out, so that's probably what happened, don't really feel much. But maybe they're ignoring me, or maybe they're angry with me, right? And then we might feel sad or hurt, or gosh, I hope everything's okay. We might feel anxious and worried, right? And what stands out to people about this? So I just read you a scenario, same scenario, and here, anything stand out to people about this? So lots of negative thoughts up there. Yeah, what did you think? Exactly. Yeah, lovely, right? So there are lots of possibilities of what could be going on, but we think we know, right? We think we know what happened. And a lot of these tend to be negative. So perhaps this tells us we should be a little bit more skeptical or balanced about our thinking, right? Can these all be true? Right? They can't all be facts about the situation. And where do all these different interpretations come from? right? So our interpretation can depend on so many things. It can depend on our mood. Did we just get good feedback that day at work, or did we just get reprimanded, right? Have we eaten lunch? You guys have eaten lunch, so you're okay. But, right, does anybody get hangry? That could affect you. But certainly your previous experiences, the way you think about yourself, the way you think about the world are going to influence this. So what this suggests is that we really need to think about improving our skills for making sure our thinking is balanced. So regardless of whether our interpretation is true, we're going to feel an emotion about it, right? So don't we want to be thinking about it in a way that is most accurate or most true, right? So these are really, the skills in this section are really the gold standard treatment for CBT for anxiety and depression. And what we've got here is that we have a situation, and it's not just the situation that impacts our emotion, it's our interpretation of it. And so this is really what we're going to hone in here on, is our interpretation. And this is really starting to pay attention to kind of what do we say to ourselves here. And I just want to point out that we've got situation, interpretation, and emotion here. But certainly this has consequences for our behavior, right? So imagine that I'm trying to lose weight and I hit a plateau and I think, you know what, I knew this wouldn't work, it's not worth it anyway, I can't do hard things, right? Then I'm going to feel sad and discouraged. And then what do you think I'm going to do? I can't hear people. Yeah, right? Maybe I will soothe myself in a pint of ice cream. Certainly not going to go meal prep, right? So this is really impactful on not only our mood, but our behavior, and it goes on, right? So the first step is that we want to become more aware of what we say to ourselves. So in a lot of ways, we don't walk around thinking about what we're thinking, right? We're just kind of living our lives. And maybe we become aware when we have a really strong emotion that like breaks through the surface, right? I feel sad, I feel anxious. But a lot of us walk around with a pretty consistent running commentary, right? Oh, well, I did that pretty well, but I should have done that better. And what's with that shirt? And right? So we just like are constantly commenting on what's going on. And so the first step is really just to become more aware of that self-talk and what we're saying to ourselves. Because as we're seeing, that's really impactful on our emotions, right? And knowing that this commentary tends not to be particularly kind, the second part is really that we need to be checking the facts, right? So one example that we know from the research is that when we are anxious or low, we tend to only attend to information that's consistent with that mood. So already there's a bias in our thinking for negative information, right? And we all tend to commit kind of common errors in thinking, right? So we might catastrophize, right? Oh, I tripped. They're all going to think I'm such a klutz, and then they're, right? So we might do something like catastrophizing. We might mind read, right? Oh, well, she's not smiling. She must really not be liking this presentation, right? So we want to be careful of these types of things. And one way to do it is to practice checking the facts or checking our thoughts, right? So we're going to do this. Certainly you don't have to ask yourself all of these questions every time you feel a negative emotion, but when you start to notice that you're feeling a strong negative emotion, I would encourage folks to check in and say like, what am I thinking right now? Like, what is going through my mind, right? So if we imagine a situation perhaps where we get some negative feedback at work, or we make let's say we make a mistake at work, okay? Anyone ever make a mistake at work? Yeah, right, it happens. So we make a mistake at work, and let's say we feel really anxious, guilty, okay? And then we want to check in with what am I thinking, right? So maybe I'm thinking, oh my gosh, I'm going to get fired, and I'm such a bad worker. How could I have done this? Right? Not out of the realm of possibilities, I don't think, of what we might think. So this is usually where we stop, like it's true, right? Like there's no questioning it, that's just the way the world is. Well, we want to go on and be a little bit more careful, right? So the first step is, okay, great, what makes me think that this thought is true? Or what's the evidence that this thought is true, right? And sure, I made a mistake at work. Okay. Now, what is the evidence or what makes me think this thought might not be true? And this is what we often miss, right? We talked about how we have this kind of preference for information that is congruent with our mood or our affect, so we might miss other information that would be important to consider, like, well, I just had my annual review and that went fine, and I do this task every day and I don't often make mistakes, and I've generally gotten pretty good feedback, and I've never heard of anyone being fired for having a typo in an email, right? So ultimately, we want to work to see if there's a more balanced way to think about it. Is there any other way to think about this situation besides beating myself up that I'm going to get fired and I'm a really bad worker? You know, it's disappointing that I made a mistake. I'd prefer to be more careful. At the same time, there's a lot of evidence that across the board, I tend to do pretty well, right? So it's not like we're like, woo, feeling great about our mistake, but certainly slightly less anxious and guilty, right? So some other questions that can be really helpful to check the facts here. The first is like, how useful is this way of thinking, right? If I keep telling myself this, what's going to happen? I'm going to lose my job. I'm such a bad worker, right? I'm going to feel anxious. I'm going to feel on edge. It's going to spiral. Certainly that process is going to negatively impact my ability to do good work, actually, right? Or what if I changed my thinking? What if I kind of said the latter, like this is disappointing, it's not ideal, but generally I do good work. Maybe I'd feel a little bit of appropriate disappointment and move on with my day, right? Another question that I love this question, because we're all really kind to other people. We're just not so kind to ourselves. Yeah. So we want to ask ourselves, if I had a friend or someone I really loved who were in this situation and they came to me and they said, Sophie, oh my gosh, I'm going to get fired, and I'm such a bad employee, I can't believe I did this. What would you say to them? You would say, are you kidding? You get great feedback all the time. Everyone makes mistakes. But we can't say that to ourselves, right? So this question can be a really nice prompt. And then sometimes it's helpful to ask ourselves, okay, given all this information, like what should I do now? Should I go online and look for other jobs? Or should I go engage in my work, right, in a way that is calm and planful and make up for this mistake? So that is this process of being more careful or balanced about our thinking. And I want to point out that we're not going for Pollyanna, so I showed a glass that's like right in the middle there, right? We're not going for optimism or necessarily glass half full. We're just trying to be balanced in the way that we're looking at things. Does that make sense? Okay. So these are some workbooks or self-help resources related to this checking the facts. And on the last slide, there's a link. I'm going to have all of these resources there, so don't worry about writing anything down. So this is my favorite, okay? So on to the second strategy, which is increased awareness. And part of why I am so darn passionate about increased awareness is that in this previous example, right, we have to become aware of our thoughts before we can intervene on them. We actually have to become aware, period, before we can make a change about anything, right? So skills for increasing our awareness, or mindfulness, is one really important skill. And the way that I like to think about this is if you think about your attention or your awareness as a spotlight, right? Right now, my spotlight is on you, right? It may get pulled away to like, oh, I wonder if there's any lunch left, but then I'm going to bring it back to you, right? And we want to be in control of where that spotlight of our attention is, right? I want to be like, okay, looking at you, looking at you, looking at you. However, what happens when we're anxious and stressed is that that spotlight of our awareness gets hijacked. It gets hijacked by each passing thought and urge an emotion, right? A thought comes and we think, I've got to think about this. And then we're so far away from the present moment, right? So mindfulness is really increasing this muscle of our attention so that we can put it where we want it to be. So there's a lot of evidence that this is really effective for stress reduction. So in 2014, in a review by Sharma and colleagues, they looked specifically at the impact of mindfulness for stress reduction. They found that 16 out of 17 of the studies that looked at this found positive changes in both physiological and psychological outcomes related to stress and anxiety. Furthermore, there was a review recently in the Journal of the American Medical Association, and they found that meditation programs can have small to moderate effect sizes for reductions in multiple negative dimensions of psychological stress. And you may be thinking small to moderate, that's not very exciting. Well, they pointed out that these effects are similar to the use of antidepressant medication. So you have similar effect sizes at the same time you have a reduced no side effect profile, really, of mindfulness, right? So mindfulness is associated with lots of wonderful benefits that I'm sure we've heard all about, right? Like increased positive emotion, reduced rumination, increased emotion regulation, reduced blood pressure, increased immunity, right? So I don't have to convince you of the benefits of mindfulness, but I'm tempted to. So then what is mindfulness, right? So this is a commonly accepted definition of mindfulness: awareness that arises through paying attention on purpose in the present moment non-judgmentally. So as you may know, mindfulness has its roots in Eastern meditative practices, and it really can be, it's based on Vipassana meditation, which can be translated to insight meditation or seeing with clarity. So what mindfulness aims to do is help us see our experience in a way that helps us understand how we create suffering for ourselves and use this muscle of our attention to free ourselves from those patterns that increase our suffering. So there are really two components of mindfulness that are, or like two wings of mindfulness that I think about. This first is the intentional self-regulation of our attention. So can I put my attention where I want it to be in any given moment? And the second piece is the how of mindfulness. So we don't do this like yanking our attention really like harshly or like kicking ourselves in the butt, right? We do this with a sense of kindness and compassion in a way that is gentle, right? So there are these kind of two components here. And although people can vary in their trait levels of mindfulness, we know that this is a skill also that can be cultivated through practice in meditation. So, we might think about, we've been talking a little bit about anxiety today, which is really this kind of future thinking, right? Anticipation of the future. We leave where we are and we're in the future. Or if you think about depression, really it's rumination in the past on past failures, and so being in the present moment is really the alternative there. And so this is a slide I really like. It can be helpful to think of mindfulness as a tool to shift out of this kind of doing mind and into being mind. So certainly there is a place for doing mind, right? I'm not saying get rid of doing mind, right? This is how we solve complex problems. This is how we just did our taxes. This is how we balance our checkbooks, right? We are good at solving problems. However, this strategy breaks down when it comes to negative emotions, right? So try solving sadness. We end up getting pulled into the mud and stuck. Well, why do I feel sad? Maybe I should have done this differently. I'm just going to be sad forever, right? So we are working to shift through mindfulness out of automatic pilot, right? So automatic pilot is like, ever drive home and you're just home all of a sudden, you don't know how you got there? That's automatic pilot. When we're in that mode of mind, it's very easy to get hooked in anxiety and stress in a way that we're not aware until things get really bad. So this alternative, conscious awareness and a choice of how to respond, right? Doing mind is analytical, trying to figure things out, which often gets us stuck. Being mind is sensing, right? So emotions left to their own devices do not last very long. Just a couple of seconds. But doesn't it sometimes feel like emotions last forever? Well, it's what we do to keep them around, right? So if we can simply sense the emotions, let them come and go, we can step out of that loop. So, you see here doing mind is striving or trying to get somewhere, trying to always feel good. Well, that's not possible. So being mind is accepting and allowing. In doing mind, we treat our thoughts as facts, and we just saw our thoughts are not facts, right? So in being mind, we can see our thoughts as events of the mind. In doing mind, we approach pleasant and avoid unpleasant experiences, right? We just saw some of the consequences of trying to avoid anxiety, right? Substance use, overeating, these things that we try to do to avoid negative emotions. So the alternative is allowing and approaching all experience as it arises. So this may seem kind of radical, right? Like, why would I want to do that? Oh my goodness. Part of what this means is that being with our emotions as they arise can really give us access to wisdom that we may not get if we're really busy running away from that initial emotion. So I often use the example of applying for a grant, right? And I don't get this grant, which is typical. And what happens, right? I get pulled into, oh my gosh, this is so unfair. This was a really good application. Those reviewers, they just had it out for me. Ugh. And gosh, my career, it's going nowhere, right? I'm going to be jobless. Okay, so if I can cultivate some mindfulness and notice that I'm really getting stuck and come back and say, hold on, what am I feeling right now? What emotion is here? Well, I'm feeling kind of disappointed and sad. Okay, well, what's good about noticing that? Well, I really care about this project. I actually think this is really good, and I value this. And so maybe by accessing that emotion, by allowing that emotion to be there, I may have access to some wisdom, right? Maybe there's a way I can do this without funding, or maybe there's another, funding mechanism I can apply to, but we miss all that if we get stuck in the mud, right, of being angry and self-critical. Does that make sense? It's hard to give examples of mindfulness because it's very experiential, but I just want to read one quote that I think kind of embodies this better than I can. So it says, when you relax your driving desire for comfort, real fulfillment arises. When you drop your hectic pursuit of gratification, the real beauty of life comes out. When you seek to know reality without illusion, complete with all its pain and danger, this is when real freedom and security are yours. So I think what this shows is that mindfulness is not passive giving up. This is a real active choice to allow our experience to be as it is, as opposed to what happens when we get caught pushing away aversive experiences and clinging to pleasurable experiences. So this sounds pretty lofty. How do we cultivate this? Anyone in here already have a mindfulness practice? Yeah, so I'm not talking to complete beginners here, but so there are a couple different ways to practice mindfulness. One is through formal mindfulness practice, and this is focusing our attention on one thing in the moment. This can be our breath, this can be our body, this could be sounds, just anything that's happening right now, and using that as an anchor to notice when our mind wanders and bringing it back. And we're bringing it back in a way that's kind. We're curious about where our mind goes so we can get to know our mind better. And we are ultimately doing this in a way that is not outcome-oriented, right? So these women are kind of sitting like this, but there's no right way to meditate, right? As long as we show up and we are with our experience, whether our mind is busy or our mind is clear, that's meditation. The other way to practice mindfulness is this bottom picture here, and like this is me a couple months ago, right? And so informal mindfulness is bringing a different kind of awareness to our experience. So I could be shoveling and thinking about, oh my gosh, this winter, I haven't seen the sun, I cannot believe Ohio. Why am I out here? Why isn't my partner out here, right? I could just be suffering, right? Or if I want to do this activity with mindfulness, I can be looking at the snow, noticing kind of how the sun hits the snow. I could be hearing the sound as I'm shoveling, feeling the muscles in my arm engage, getting pulled into ruminating and coming back, right? So that is informal mindfulness. And you can do this with anything, washing your hands, washing the dishes, drinking a cup of coffee. So in the spirit of this being something that is experiential, guys, I want to have us practice just for 5 minutes here, and then I'll open it up for questions, okay? So I'm going to go ahead and lead us through a mindfulness practice. And you're welcome to refrain from practicing if you'd like. However, of course, I invite you to practice. And we'll do this for maybe I'll make it 3 minutes because I'm a little short on time. So what I'll ask everyone to do is to just sit up in your seat in a way that is alert and awake, maybe even dignified. Let your feet rest on the floor. Let your hands rest on your lap. And I will ring the bell once to begin and 3 times to end, and I will let you know what to be focusing on, okay? So starting off here by just getting in touch with the sensations of sitting here in this moment, perhaps feeling your feet on the floor, noticing where your body makes contact with the chair, feeling your hands as they rest in your lap or on your legs, just arriving in this moment. And when you're ready, starting to become aware of the fact that you're breathing and feeling the breath at the belly. So starting to notice the sensations as the belly expands and contracts. And there's no need to change or alter the breath at all. Just letting the body breathe itself. And pretty soon you may become aware that the mind has wandered away from the breath, maybe to thinking or planning other sounds in the room. And that's okay, that's what minds do. When you notice, just take a moment to acknowledge where the mind has been and direct it back gently to the breath at the belly. Feeling the length of the inhale and the length of the exhale. Remembering the intention is not to get rid of thoughts, but to notice our experience just as it is. Breathing in, aware you're breathing in, and breathing out, aware you're breathing out. And as many times as the mind wanders, gently acknowledging where the mind has gone and guiding it back to your awareness of your breath in your belly. And as the practice comes to an end, just taking a moment to congratulate yourself for being with your breath and being with this moment. So that's it. That's mindfulness. So I just want to talk really quickly about a couple more resources before we end. So these are some workbooks that are focused on mindfulness. These are some apps that will guide you through mindfulness practices. I really like Insight Timer. It has a little timer you can just set for 5 minutes, and it's a gong, kind of like my gong. I think that Calm and Headspace may not be free, so watch out for that. And then at the very end, so quickly, when should you seek professional help? We talked about some negative consequences of stress and anxiety, right? If your routine has changed, if it's starting to interfere with your life, if you're feeling distressed or especially suicidal, seeking professional help is really important. So there are a bunch of resources on here, one of which is the Mindfulness-Based Cognitive Therapy program that I run here. I'm going to have all of these resources. I made a website. Guys, this is crazy. So if you go to this website, there's a section for workbooks, books, links, more about the Mindfulness-Based Cognitive Therapy program that I run here. So all of these resources are accessible to you. But also, I'm accessible for you for the next 7 minutes or so. Sorry if the end was a little rushed there. What questions can I answer for people? Try to take a step down so I'm accessible. Okay.
Is it significant that when you ask about possible responses to someone not waving back or speaking, all of the responses, or at least I felt, all of the responses were focused on the person thinking it, except the last one. I hope that person's okay. Do you have any specific recommendations about trying to balance those things too? Is this about me or is this about them?
Yeah, that's a really great question, right? So I do think that we tend to make attributions for things that have to do with us as opposed to looking at the person or the situation. And certainly through practice and looking at other possibilities, right? If you asked yourself, would there be another way to think about this, or what makes me think this thought might not be true, we might say, I know that they actually have a lot on their plate right now, or I know they just got bad news. So by using these skills, we can open ourselves up to more possibilities. That's a great question. Yeah.
What suggestions would you have for some of us in lower positions to try to get our leadership teams involved in things like this? Because sometimes we've talked about competing priorities at work. Sometimes our leadership teams are not into the whole work-life balance thing, and it's just work, 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 and we're at home, and there's emails and texts coming in. It could be hard for some of us to tell our supervisor, hey, I need some me time on Sundays.
Yeah.
Not,
I hear you, and I feel you, and I hear that all the time. So there are a couple of things that come to mind. One is certainly there are initiatives that we have here, like Buckeye Wellness, that are at lunchtime, exercise classes and yoga classes that are after work. The other thing that I didn't talk a lot about is certainly assertiveness, right? So by improving our assertiveness skills and at least trying to ask for what we need, we may be able to open up some time and space to take care of ourselves better. Also, some of these meditations are 3 minutes long, right? So if we can sit in the car before we go into work and do a brief meditation to allow us to shift maybe into being mind for a moment, even though it's not a lot, it's something in a way to take better care of ourselves. So I appreciate that question, yeah.
Yeah, if you email buckeyewellness.osu.edu, I can forward your information to Bern. She meets with all the department leads and chairs at each college throughout the university to change that culture. And that's kind of what Buckeye Wellness is all about. Thank you.
We have time for another question if anybody has another question.
Going once?
I'll hang around too.
All right. Thank you so much.
Yeah.
Thank you for attending. I greatly appreciate it. If you guys can fill out the evaluations, we take those very seriously. That's why we reached out to Dr. Lazarus here. Next, Lunch and Learn will be at DLHRI 170. For all the nurses in the room, it will be for Nurses Week. It'll be Bern Melnick, our Chief Wellness Officer. If you have not listened to her speak, she is amazing. So feel free to come out to that. That is on the YP4H page for registration. Thank you again.